Morning Line with Nancy, and it is time for our conversation segment. We have two gentlemen joining us this morning to look at the issue of water, sanitation and hygiene, and how all of these affects socio-economic growth, economy, so to say.
Indeed, we have with us Dr. Ayuwaja Nayagawa. He's the National Treasurer, Nigeria Medical Association, and Zaid Jurji. He's the Chief of W.A.S.H, Unicef. Thank you for joining us, gentlemen.
All right. The first thing that comes to my mind as I'm sitting here is the warning on open defecation. Already, Nigeria is said to be, because the government is still not agreeing with the fact that we are the headquarters of, say, poverty. Nigeria has been said to be the headquarters for poverty in the world, and now, and same India, you know, overtook India in that. Now India again is almost going to leave us with the issue of open defecation as we are number 2. Now, how bad is this, Dr. Zaid?
Okay, good morning again. According to surveys that were carried out by the National Bureau of Statistics in cooperation with the Federal Ministry of Water Resources and with support from UNICEF, open defecation stands at 25% of the population. This is 1/4 of the population. 1 in every 4 Nigerians defecate in the open. Of course, because of the fact that Nigeria is the most populous country in Africa, it ranks the first in Africa, and worldwide, as you rightly said, Nigeria is the second after India. But India has made commitments, full commitments, and 4 years ago until now. I mean, this year the federal minister attended the Mahatma Gandhi International Sanitation Convention, and he was put to know all the facts that led to this incredible progress. They call it the Concord Leap, because the progress was like that, and once they decided that this is something that should end, the rate of sanitation coverage started to increase. And 1 year from now, they have decided to eliminate open defecation and declare India as open defecation-free state. And of course, this would leave Nigeria very unfortunately in the first place.
Dr. Zaid, still staying with you before I come to Dr. Ayuwaja, how do you think we have the right policies in place in terms of ensuring that this issue of us moving to even number 1 position does not happen, from what you have seen?
Well, policies are there. What matters most is the commitment and the activation of the policy. This is something that needs to happen. I think all of you know that 5-6 days ago, the state of emergency of the water sector was declared by the highest authority in the country, by His Excellency the President. And there is an action plan to revitalize the water sector. Now, this will need to happen. And the first thing that needs to happen is to make sure that there are sufficient budgetary allocations for the sector. And here I'm talking, when we talk about WASH, it's water, sanitation, and hygiene together. They work together. I mean, the open defecation component is one of those. Of course, when it comes to open defecation and the need to construct latrines, the community will have to play their role. But the community will need to be made more aware of what needs to be done. They will need to be more aware of the negative part of defecating in the open, all the diseases, all the losses that will be incurred on the finances of the household, girls not attending schools, the bad effect on the health of the family members. And the system, of course, systems will need to be established and financed by the government to make sure that this is happening, that there are options. There would always be, of course, because this entails money coming from the communities, there would still be people who will not be able to pay it either immediately or at a later stage. And we are working with the water authorities at the field, and we have set some systems that would be able to do that. People could tap into resources, they could take loans, construct their latrines, and pay it at a later stage when money is available. There are also some communal systems, we call them the adaches, where there is the solidarity shown between households. They loan to one family in 1 month, the next month it will be the other
Next
family,
person.
and so on and so forth. So there are means and ways. We need to have the required awareness by the population, and of course there will need to be a commitment from the authority side.
Dr. Ayuwaja, the issue of water, sanitation, and hygiene definitely is affecting our economy. We don't even, looking at the data we have, talking about over 400 billion being lost. Is that really what it is, or this is just the data that we have? How bad is this affecting our economy?
Well, thank you for the question. The true thing is that I think it is affecting our economy badly, in the sense that if you have to look at the man-hour that is spent in the hospitals as a result of poor hygiene problem or poor water supply, you find that you only you don't even have any reason to argue. If you go to the hospitals, you find people that are really sick as a result of poor hygiene, poor water supply. Especially children, if you go to the hospital, you find children that are admitted for fault of not their own.
Yes.
You find that, in fact, they come with the worst complications from typhoid, for instance. You see children that will come with typhoid perforation. Go to the hospital, you find them. And then it is their parents who are possibly working class members that will have to go and take care of these children in school. So if you calculate it as for the number of hours spent out of work, you discover that the amount that Nigeria is losing every day is so huge. And the simple reason is that we lost this at the in the 70s. I know that time we have the sanitary inspectors who usually go around to find out, they go into houses to find out their sanitary level, their source of water supply, so that they can make adequate recommendations for government, or they can even outrightly sanction somebody whose compound is not good.
Wole those days, that's
Yes.
what they call them.
So, but unfortunately, it is not happening. The simple reason also is that our health system is turned upside down. You discover that everybody who is sick would like to go to the highest level instead of going to the primary health care, which the primary health care is supposed to take care of the immediate environment, but they go to the teaching hospitals for minor ailments. Therefore, you discover that even the budgetary allocations now, you discover that the budgetary allocation at that level is so minimal. More especially so, you know that the local governments are operating under the state government.
Yes.
And with the issue of joint account, in fact, the local government is at the mercy of the governors. It is only what they decide to release to the local government that the local government will use. So sometimes the local government cannot even pay salary, talk less of using money to go and do inspections. So actually, Nigeria we have to reprioritize our needs.
Doctor, in your interactions with the parents of, you said children are most affected, and probably in your interaction with Nigerians about this issue of sanitation and hygiene, do you think enough awareness has been created for people to know the implications of this?
Well, thank you for the question. The awareness is not there, in the sense that you discover that those that have this requisite knowledge to impact on the population, they are no longer at that level. I mentioned the issue of the sanitary inspectors. You discover that in those days, they were the ones that will go and tell them how to clean their toilets, how to clean their gutters, how to wash and do all these things. But unfortunately, that one is non-existent. And therefore, it is only the few that possibly, if they go to the hospital and have contacts with a health worker, that will now educate them on the fact that, look, this problem that you are coming with, in fact, wouldn't have even arisen if you have taken good care of the sanitation of either your water, your cooking utensils, and so on and so forth. But unfortunately, such line of information are not there. In those days, you find that they even go around with loudspeakers, talking, telling people that this is what you do, this is how to control this. But unfortunately, for now, it is non-existent.
Dr. Zaid, I'm sure you must have carried out some research on the issue of water, sanitation, and hygiene. Let's break it down to areas where we have these issues, probably highest in terms of states or areas where there needs to be focus, so because I'm sure in some states the indices is not as in some others.
Well, I think the coverage figures are so low that it doesn't make it more meaningful to define states. They are all at low performance when it comes to coverage of water services and sanitation services. Now, I'll give you some figures. 2/3 of the population in Nigeria are covered with what we call basic water services. And basic water services, that was the requirement of the MDGs, the Millennium Development Goals that ended in 2015. And unfortunately, Nigeria did not achieve that. Now, the SDGs, the Sustainable Development Goals for the year 2030 were set, and they are much more stringent. I mean, they call for a quality service. So now we are talking about a safely managed water source. And if we measure Nigeria's performance according to that indicator, I mean, the figure is as low as 3.7%. It's really, it's shocking. It's shocking. And then if we try to dig deeper, because it's not only a matter of providing the service, it's a matter of sustaining the service. Now, if you go to a water system and see that it is functional today, what is the probability that you see it functional when you go the next day? And we measured an index for that. We formed a composite index to measure that. The figure stands at 11%. 11% of the systems have the means to remain sustainable and functional. The other aspect, 40% of water systems that are constructed break down during their first year of construction. It tells you something about the quality of work that we do. Really, the issue is so complicated, and the declaration of the state of emergency is just timely, because something needs to be done now and immediately.